Sinusitis is defined as inflammation of the sinuses, and the cause of that inflammation can be many different things, whether it be either the sequela of a viral infection with a secondary bacterial infection. It can be caused by the anatomy of the sinuses, causing blockage and crowding and resultant unhealthy state of the lining of the sinuses. Patients can become allergic to environmental allergens such as pollens and mold spores. They also can become allergic to bacteria and mold that colonize their sinuses. But the end result is that the sinuses are blocked partially by swelling of their own lining. It's that inflammatory state of the lining that we try to address both medically and surgically. We try to differentiate between an upper respiratory infection such as a common cold and a bout of acute sinusitis based on the symptoms. We don't have to have an X-ray or a CAT scan to differentiate and begin treating acute sinusitis. But generally, acute sinusitis is defined as an upper respiratory infection associated with facial pain, dental pain, retroorbital or eye pain, foul nasal discharge, congestion, nasal obstruction, postnasal drainage, perhaps a fever that's lasted more than 7 days. For acute sinusitis, which is a sinus infection that's lasted less than 30 days, for instance, we begin with hydration. Becoming dehydrated or dry can cause a patient's nasal secretions to thicken and become more blocked. We encourage them to use nasal irrigation. There's a multitude of different kits available that can be used for nasal irrigation with saline or salt water. If there is allergies, appropriate treatment with antihistamines. We use nasal steroids, which are topical treatments with steroids that stay within the nose and reduce inflammation. Appropriate antibiotics. Often we'll use nasal endoscopes to culture the sinus openings to select antibiotics that are appropriate for that infection. Surgery is generally indicated only for chronic sinusitis. There are occasional patients with the complications of acute sinusitis where the infection is breaking out into the orbit, for instance, into the eye socket. It may be somebody who would have surgery with just an acute infection. But generally it's a quality of life decision based on how long they've had symptoms and the severity. It can be recurrent sinus infections or more a continuous sinus infection. I think it's appropriate for patients to begin with over-the-counter medications such as Mucinex or guaifenesin, which is a mucus thinning medication. It's best taken with plenty of water. Decongestant nasal sprays can be used in the very short term. Long-term use of sprays such as Afrin or Vicks or four-way nasal sprays actually cause the lining of the sinuses to become more inflamed. They constrict the blood vessels, and then over time those blood vessels become more dilated, more swollen. Over-the-counter antihistamines are also appropriate if there's an allergy component, particularly spring and fall. And decongestants are like Sudafed are available, but they can cause increased blood pressure. They can cause insomnia. They also can interfere with bladder function. So they have to be used with care. The standard operations now for sinus surgery are very different from the ones that I first began doing 25 years ago as a medical student. Now, almost every sinus operation is performed as an outpatient with general anesthesia and occasionally with sedation or local anesthesia, using lighted endoscopes or telescopes that are placed inside the nose, where we can look at the areas of blockage and disease with high-definition monitors. And we use small powered microdebriders that remove very small amounts of tissue, where we can control bleeding and control the degree of surgery. There's even balloon sinuplasty techniques that we can use. We can do a wake in the office. That's an outflow of the technology that's come out of the cardiology world, where rather than doing an open heart type of bypass surgery, they go inside the artery, balloon it with a balloon, and place drug-eluting stents. That same technology is happening in our specialty with balloons used under sedation or under local anesthesia to open the sinuses, perhaps place medications or stents into the sinuses, and then they can get up out of the chair and go home.